Aphthous stomatitis. Recurrent aphthous stomatitis, or RAS, is a common allergic and immunologically mediated disorder of the oral cavity. This is characterized by the development of painful, recurring, solitary or multiple ulcerations of the oral mucosa. Coming to the etiology of oral aphthous stomatitis, over the years, numerous possible etiological factors have been implicated in the causation of aphthous stomatitis. First and foremost is bacterial infection in the form of an L form of Aphthous hemolytic Streptococcus sanguis. It is thought that there is an immunologically hypersensitive reaction to the L form of Streptococcus, which is responsible for the development of aphthous ulcerations. Coming to the second possible etiological factor of immunological abnormalities, certain HLA types have been implicated with development with a higher recurrence of aphthous stomatitis, namely HLA B51. Other immunological abnormalities include other factors which are of possible etiological significance in the development of aphthous ulcers include nutritional deficiencies, namely iron, vitamin B12, and folic acid. Now, the causation for these factors is very tenuous, and they are thought to have just a precipitating role rather than a main etiological role. Now, there are certain predisposing factors for the development of aphthous ulcers, namely trauma, stress, hormonal alterations, food allergies, and a family history. Now, all of these sum up to three main basic causes, and that is, there is a primary immunodysregulation of the oral mucous membrane, which because of a result of a decrease in the mucosal barrier or an increase in antigenic exposure. These three factors underlie all the basic etiology and predisposing factors and can result in the production of aphthous ulcers. Now, clinically, recurrent aphthous stomatitis appears in three major forms and an additional form which is associated with Behçet syndrome. The three forms are recurrent aphthous minor, recurrent aphthous major, and recurrent herpetiform ulcerations. The most common of these is the recurrent aphthous minor, which comprises about 80% of cases. The second, less common variant, seen in about 10%, is called recurrent aphthous major or Sutton's disease, and a previous term that was used was periadenitis mucosa necrotica recurrence. This comprises less than 10% of cases. The third form, which is very similar to herpes simplex infection, and that is why the term is herpetiform, is the recurrent herpetiform ulcerations. This is comprising of multiple small lesions which are scattered, which appear as crops on the oral cavity. The fourth form is an association with a syndrome called as Behçet syndrome, and these comprise the clinical types of aphthous ulcerations. A little more into detail about each of these types. This is the clinical appearance of aphthous minor. And as we can see, there is an area of ulceration covered by a yellow pseudomembrane, and there is a surrounding area of erythema. This is the classic presentation that we see. And as we can note in these pictures, most of these cases appear on lining mucosa or movable mucosa. So it is non-keratinized areas which are affected by aphthous minor. These are also called as canker sores, and they arise predominantly on non-keratinized mucosa, namely on buccal and labial mucosa, ventral surface of the tongue, and soft palate. The characteristic clinical appearance is that it initially starts as a reddish macule. So it starts as an erythematous macule. It develops an area of ulceration which is covered by a yellow-white membrane, and it will be surrounded by an area of erythema. Usually, the size of these lesions is about 3 to 10 millimeters in diameter, and they heal without scarring within about 7 to 10 days. Now, about 1 to 5 lesions can be expected during each episode, and they are very painful. And the recurrence rate varies between 2 episodes per month to 1 episode per year. That varies in individuals. The next type of aphthous ulceration is the major aphthous ulcers. As the pictures can see, as we can see in the pictures, the size of the lesions is much larger. These lesions tend to be much more deeper compared to the aphthous minor, and there is a predilection for occurrence in the posterior part of the oral cavity or the oropharyngeal areas. Now, major aphthae are larger. They have a longer duration. They take longer to heal per episode, and the ulcerations are much deeper than the minor variant, and the size can vary from about 1 to 3 centimeters in size. So it is much larger compared to the minor aphthae, and they take from anywhere between 2 to 6 weeks to heal. So it can easily go for more than a month to heal, while for minor aphthae, it will take only about a week to heal. Now, what is important for major aphthae is that these usually heal with scarring. These aphthae are deeper, so they heal by scar formation. The areas which are commonly affected are the soft palate and the tonsillar fosses and the facial pillar areas, that is more towards the posterior part of the oral cavity. And one important aspect that needs to be remembered clinically is that the major aphthae have an increased incidence in HIV infections. The herpetiform aphthous ulcers are, like the name suggests, they are similar to the lesions seen in herpes simplex infections. Now, here these are characterized by crops of multiple small pinhead shallow ulcers, and there are a large number of lesions which are very small. So the diameter can be about 1 to 3 millimeters in diameter, and the number of lesions can be as many as 100 lesions at a time. The individual lesions may coalesce and form a larger ulceration. These heal within a short period, that is about 7 to 10 days, and the recurrences tend to be variably spaced. This is the appearance of the herpetic ulcers, multiple small pinpoint ulcers scattered throughout the oral cavity. So here there is a compilation or a comparison, a tabular comparison between the 3 main types of Aphthous stomatitis: aphthous minor, aphthous major, and herpetiform. The size of the lesions for aphthous minor ranges from less than 0.5 centimeters, while for aphthous major, it is larger than 0.5 centimeters, can range up to 3 centimeters in size. Herpetiform ulcerations tend to be about 0.5 centimeters, similar to minor. The shape of the lesions tend to be oval in aphthous minor. The number of lesions in aphthous minor range from 1 to 5. Duration is about 7 to 14 days. The location is non-keratinized mucosa, and the characteristic features include fewer recurrence and shorter duration. This is the most common type also. Treatment, usually, if it is problematic for the patient, we can give topical corticosteroids and tetracycline mouth rinses, or a hexagel or dologel kind of topical over-the-counter applications can also be administered. Major aphthae are usually larger than 0.5 centimeters in size, can range up to 3 centimeters in size. They tend to be much larger. They have a ragged oval or a crateriform appearance. They are quite deep. The number can range from 1 to 10, and the duration of these ulcers can be for about a month, that is about 3 to 6 weeks. This also occurs on non-keratinized mucosa of the soft palate and tonsillar fosses. These have the longest duration per episode, and they heal with scar formation. The treatment needs to be a little more aggressive than what we have done for minor aphthae. So topical or systemic intralesional corticosteroids may be needed. Sometimes even immunosuppressive drugs could be required. Coming to the third type, or herpetiform ulcers, the size remains quite small, less than 0.5 centimeters, multiple pinhead ulcers. Here the peculiarity is in the number of cases, number of lesions per episode. It can range from 10 to 100 small pinpoint ulcerations. Duration is about 7 to 10 days. Any intraoral site can be affected. And here the peculiarity of this form is that this comprises the greatest number of lesions per episode. Treatment here again is with topical or systemic steroids and tetracycline mouthwashes. The cytology of aphthous ulcers, usually these can be diagnosed clinically, but if a cytology is performed, there is a peculiar type of cell which is noticed called the Anetskow cell. This is characterized by changes in the nuclei of epithelial cells. A smear that is taken from the aphthous ulceration will show epithelial cells with Anetskow cells. These are epithelial cells which are showing a characteristic change within the nuclei, and this change is characterized by a linear bar of chromatin within the nucleus with radiating processes of chromatin extending towards the nuclear membrane. However, this is not pathognomonic. It can also be seen in a few other conditions such as sickle cell disease, megaloblastic anemia, and iron deficiency anemia. Now, the next form of investigation that we could do is the biopsy, and a biopsy and histopathology will show the features of a non-specific ulcer. This is characterized by a fibrinopurulent membrane covering the area of ulceration, and the underlying connective tissue will show an intense inflammatory reaction comprising of neutrophils and lymphocytes. Granulation tissue will also be seen near the base of the lesion. However, these features are usually consistent with a non-specific ulcer and not peculiar for any particular lesion. Aphthous ulcers by themselves usually heal within a short period, but sometimes recurrent aphthae or multiple prolonged recurrences can be associated with certain syndromes. So the systemic disorders and syndromes associated with aphthous ulcers include Behçet syndrome, most importantly, followed by neutrophil deficiencies or neutrophilic disorders such as cyclic neutropenia, nutritional deficiencies, IgA deficiency, and Reiter's syndrome. So these are the syndromes which are associated with multiple aphthous ulcers, and a few terms which are used interchangeably for aphthous ulcers include canker sore, which is a term used for recurrent aphthous minor, while for herpes, the term is herpes labialis or cold sore. Major aphthae are also called as Sutton's disease or periadenitis mucosa necrotica recurrens. Thank you.